5 tips for after surgery recovery. Hi, I made this video because I've had 9 surgeries and I want to share 5 tips that make recovery easier. First, anesthesia can temporarily cause constipation, and the easiest way to prevent it is to take 2 stool softeners each night before bed after your procedure. Even if you go a few days without a bowel movement, it will pass easily when you feel ready. Without stool softeners, stool can harden inside and make it nearly impossible to use the restroom. Second, if intravenous pain medicine doesn't last long enough or feels too strong, you can request pain pills instead. They usually last 3 to 4 hours compared to medicines like morphine, which often only last 1 or 2 hours and can make you sleep heavily, only to wake up a few hours later in intense pain. If this happens, tell your nurse and they can request something in pill form. Third, if you feel nauseous or have trouble sleeping, tell your nurse right away. Often there's already a sleeping medication on your chart, and nausea medicine can be requested quickly if needed. So speaking up early helps because it can take time for the nurse to get permission from the doctor to add or adjust medications. Fourth, hospital nights are full of interruptions like vitals, blood work, and pain medicine, so you might not get a good night's sleep until you're home. If you're desperate, ask the staff for a short undisturbed nap because even a few hours of rest makes a big difference. Fifth, bring gum or breath spray to help with dry mouth if you're not allowed to eat or drink. Pack a bag with all your hygiene and grooming items, and don't forget your phone charger. You can also shop for drinks and snacks to have in your room and have a friend or family member bring them after you're settled in. To recap, take stool softeners to prevent constipation, ask for pain pills if 4 medicine isn't enough, speak up about nausea or trouble sleeping, don't expect perfect sleep in the hospital, but nap when you can, and pack gum, snacks, drinks, and your personal items. I'm not a medical professional, and this video shares my personal experience for comfort and recovery, so always follow your doctor's instructions. If you found these tips helpful, check out my last video, 5 tips before surgery, which I'll link at the end, and thanks for watching. Don't forget to like, subscribe, and hit the notification bell so you won't miss future videos about recovery and surgery.